Today, our team will introduce you the virtual realities in surgeries. Our team members are Tao Yu, Yuan Yuan, and Yi Zhang. Here is the outline of this presentation. First, we will introduce what is VR and how the technique evolved along with the advancements in the computing power. Then we will see some statistic data and the bullet points of why do we use VR in the surgeries. And we will checking out the first VR series, which is streaming online this year. And we will see more practical usage and build some design challenge when using VR in surgeries. And how do we use VR and the medical training tools in the surgery. And then we will see how VR distractions for patients after surgery will improve their surgery. And in the end, we will discuss the advantage and disadvantages of VR in the surgery. Here is a brief introduction of VR. Virtual reality means to create a simulated environment using computer technology. Instead of viewing a screen in front of them, user can interact with 3D worlds. In other words, VR is a three-dimensional computer-generated environment which can be explored and interacted by a person. The simulating can embed on anything such as vision, hearing, touching, or even smells. The advancements in computing power have enabled continued growth in virtual realities, visualization, and simulation technologies. Here is a brief history of VR. The VR technology we are familiar with is always come with a hand-mounted display. This kind of devices is based on Charles Weston's research, which demonstrated that the brain processes the two-dimensional image from each eye into a single object of 3 dimensions. Viewing two side-by-side stereoscopic image or photo through a stereoscope gives the user a sense of depth and immersion. The first hand-mounted display devices, named Viewmaster Stereoscope, is developed in the 1939. This is based on the Charles Weston's research and is still used today for the popular Google Cardboard and the low-budget VR hand-mounted display for mobile phones. The Molten Sensorama was an arcade-style theater cabinet that can simulate sound, vision, smell, and it even comes with a vibrating chair. Over the past 2 decades, global health is focused on individual diseases, and there are still about 5 billion patients over the world who don't have access for a quality surgical care, and the surgical error made by trainee surgeons could kill the patient. To avert the mortality in the developing countries, additional 143 million of surgeries are required in each year. And to meet this requirement, they will need 2 million surgeons annually. The cost of achieve this target is around $340 million if using a traditional training process. But the VR can be an easy and cheap way to educate the surgeons. The first VR surgery is coming online this year at April 14. The location is Royal London Hospital. This surgery is performed by Dr. Shafi Ahmed. And this live education can educate thousands of medical students.
So in the second part, I introduce some design challenges and the practical uses by the VR surgery technique. As defined by the National Academy of Engineering, Virtual reality is an illusory environment engineered to give users the impression of being somewhere other than where they are. How good the surgical innovation simulation is depends on both the user's willingness to believe it and the complexity of the environment being engineered. In any medical VR simulation, the interaction between the user and the environment is more complex than the standard movie or video game, and the nature of such interaction requires the simulation to run in real time. Thereby, the requirement to achieve realism in a more complex setting, but in less computation time, continues to challenge engineers. Advancing the field of VR simulation is one of the current ground challenges that has been identified by the National Academy of Engineering. To truly suspend the disbelief of reality, the resolution of the video display must be high, and the screen must have very fast update rates. This rate depends on the environment being simulated, but also medical VR simulation requires a haptic rate of at least 500 to 1000 Hz, and the graphic update rates of 30 Hz. If the environment appears realistic, the trainee's emotional and physiological response to the simulation will have a more accurate translation into the operating room. Another major factor is the fidelity of the simulation, which not only needs to appear realistic, but also must be very accurate. For example, in order to create a simulation of two interacting objects, one must detect collision between both objects and their resulting responses that would be used to update the dynamics of the object. For an average video game, where neither the details of deformation or fluid simulations are that important, it only needs to look real to the user. However, for medical simulations, the physiology and the tissue properties that need to be factored in are very complex to simulate correctly. Soft tissues are nonlinear and exhibit anisotropic viscoelastic behavior. Through these behaviors could be simulated accurately using sets of partial differential equations. They are still not fast enough to provide updates to 500 to 1000 Hz needed for haptic feedback, or even at 30 to 60 Hz for stereoscopic display. Compounding the problem of simulation of soft tissue behavior is the detection of collisions between objects. The collisions between objects are detected using proximity queries. For specific type of proximity queries are collision detection, contact points and normals, closest points and separation distance, and penetration depth. These queries become significantly more difficult when one is modeling deformable objects, such as cloth, strings, or organs. In addition to collision between objects, there is also self-collision in deformable models. Algorithms for modeling these features can be difficult, but there continue to be significant advances in this field as well. The problem of detecting collisions and computing collision response become even more challenging when the tissues or organs are cut or stitched together as their geometric topology change. Unfortunately, such scenarios happen frequently in medical procedures and would need to be modeled and taken into consideration as well. The Virtual Electrosurgery Skill Trainer (VEST) is a VR simulator that through interacting learning modules teaches the principles of electrosurgery. It uses a 3D immersive display and a tissue pad with infrared tracked status for interaction. The learning modules consist of a didactic component introduced through text on screen and a 3D basically based simulation on the right An iPad is used as an electrosurgical the actual surgical unit for inputs such as power and modes. The users can learn the concepts and techniques for cutting, coagulation, and fulguration on this device. The NeuroTouch is also a virtual surgery simulator. It uses stereo vision and bimanual tool handles with force feedback. NeuroTouch Creative is currently able to simulate 4 scenarios, include microdissection, tumor debulking, and hemostasis. NeuroTouch is now being used in surgical training and studies. This is fantastic and inspiring news because an intricate surgery, such as brain tumor removal, is particularly challenging to even well-trained or experienced doctors. A single tiny mistake damaging around nerves or tissues in human brain could cause permanent and severe damage. Microsoft's research team is introducing a new technology called HandPulse. HandPulse is a real-time articulated hand tracker that could open new doors for human and computer real-time interaction. HandPulse can accurately reconstruct complex hand poses across a variety of subjects using only a single depth camera. We imagined the following scenario could happen in the near future. A young rookie brain surgeon who is going to perform his first ever brain surgery. The surgery is scheduled on Monday morning at 9 a.m., which is tomorrow. He is extremely nervous, so he spends hours to practice and rehearse the simulated surgery on narrow touch several times until he feels confident. The next morning, he went into the operation room fully prepared, put on his surgical suit, cleaned and sanitized his hand, put on his goggle and hand scope and tracking device, which synchronizes with a robotic precision surgical arm that could implement ultra-precise crime simulation tasks, which could help prevent human mistakes. The operation involves removing a brain tumor and reconstruct the wounds with 3D printing artificial material and stem cell. During the surgical process, information and metrics such as the patient's fluctuating brain waves, blood pressure, heartbeat rate would pop up in the doctor's virtual view. The real-time update reduces the time the doctor would normally need to react to the various emergency situations. The surgery went well and nearly flawless. And the end of story, it's a happy ending.
In this part, I will introduce VR in surgery from surgeon's perspective and from patient's perspective. From surgeon's perspective, I will show you how to use VR simulation in surgical training. And from patient's perspective, I will show you how to use VR destruction in patients after surgery and help them to reduce the pain after the operation. Why we use VR simulation in surgical training. In this part, I will introduce the significance of VR in surgical training and the comparison of VR training and traditional training. In conventional surgery, the surgeon will do surgery simulation in his brain in order to determine the surgical plan before surgery. The quality of surgery often relies on the surgeon's experience and skills. All the people in the surgical team cannot share every detail in the operation. The virtual reality technology is considered to be an effective approach for trainees in surgery, especially for those trainees who lack of surgical experience. In the surgical plan phase, the VR facility can provide the three-dimensional image for surgical part. Surgeons can communicate with peers and do simulation based on the three-dimensional image in order to achieve new skills and perform proficiency in shorter time. And the traditional training contains like live animal training, human or animal corpse training, patient training, and learning from surgery recording. In live animal training, actually the anatomical structure of animal is different from human, and the cost of live animal training is relatively high. In addition, some ethical issues also exist, and trainees must follow the animal experiments law. And in patient training, the patients are normally not willing to accept the trainees to do operation on them, and there also exists clinical safety issues. And in learning from surgical recording, the trainees can learn technical skills from recording by hearing and seeing. However, the most important skill for surgeon is the operational skill and coordinate of the hands and the brain. Only learning by seeing and hearing cannot make obviously progress on the operational ability. The aim of VR as a medical training tool is to offer additional means to teach students. Students can learn basic technical skills through virtual reality simulated training platform by using a 3D computer-generated environment and wearable facilities in order to improve the proficiency in performing procedures like minimal invasive surgery. This platform is also can be used to evaluate the personal ability of the surgeon for performing specific surgical tasks. In this part, I will introduce VR destruction in patients after surgery. From some recent reviews, there is a belief that the use of VR destruction can be helpful for patients after surgery and can result in good performance in a long-time clinical trial. It is also proved that some side effects like nausea or dizziness cannot be caused by VR facilities. There is a case study from a paper conducted in a private hospital in Mexico City explores whether the application of VR destruction in patients who had undergone a bariatric surgery can decrease the level of pain or not. The VR destruction applied in this experiment is a procedure called serial ward. It is an interactive 3D environment which presented the objects that were not part of the real world and defy the law of physics. Moving pictures were accompanied by sound and that sound to generate the surprise and capture attention. The patient was instructed to generate multiple interactions in the virtual environment with the aid of the mouse. The product offered the patient the possibility of changing the scenes to avoid habituation. Here is the result of the case study. In this experiment, the patients undergo VR destruction 2 times. The first VR destruction was started 6 hours after the surgery. The result shows that there is a 20% decrease in the total time of thinking about pain, and the patient's ability in sensation or pain control improved significantly. After 18 hours later, the second VR destruction was administered. There is a 15% decline in the intensity of pain and a no obvious change in the sensation of control. There are some benefits of VR in surgery. The first, it is very safe and the surgeons can decrease the error rate. Actually, in experiments of 16 patients after surgery, the evidence provides that the surgeon who accepts the VR simulation training decreases the error rate during gallbladder surgery. Surgeons who are not trained by the VR simulator are more likely to hurt the gallbladder. And also, VR in surgery is also very effective. VR simulation can shorten the time required on performing surgical procedure when compared with those who are not trained by VR from the experiments that I mentioned before. Trainees who are trained by the simulation platform operate 29% faster on gallbladder than those who have not trained by VR simulation. In addition, VR simulation training also can decrease the incidence of surgical complications and lower the mortality rate of patients. And also, VR in surgery can be reused on a regular basis, and it can also be used remotely based on the network-based VR. However, there are some challenges of VR in surgery. The first one is the simulator cannot handle the surgical smoke. Surgical smoke is visible substance generated by surgery. It is a substance of protein, fat, and other components of human tissue due to incomplete combustion. When using electronic light, laser, and other surgical equipment. The second challenge is lack of better tracking system. We need to develop a better tracking system, find more natural ways to allow users to interact with the virtual environment. And the latency is also a problem of the system. Latency means when you make a movement in a real environment, the system needs a response time to the virtual space in the virtual environment. If you move too fast, the performance of the current system is not really too good. And the fourth challenge is the system cannot judge how much force is being applied to tissue in the virtual environment. In conclusion, the technology of virtual reality is not only a video game, but has applied in surgery and changed both from surgeons and patients. In the future, virtual reality technology will be integrated into the digital operating room, bring more security and convenience for surgeons and patients with many advanced digital technology. Network-based virtual reality technology will enable the remote sharing of vision and data in a virtual reality network environment. Surgeons can not only carry out various surgical training and practice, but also can achieve different surgeons from different locations and do surgery as in the same operating room to complete edit surgery. And also, the virtual reality in surgery can change the education of surgical training. Thanks for listening.